Well, hello and welcome home. I'm your tutor, Annalise Garrison, and today we're going to talk about a topic I didn't even know was on the NCLEX until a few weeks ago. Somebody called and said, "Hey, Miss Garrison, did I pick the right answer for this question?" Of course, she couldn't tell me the question word for word, and I didn't have a clue as to what she was talking about. So it's taken me all these weeks to research this topic and to bring this presentation to you today. So we're going to talk about medical ethics for the NCLEX, 5 basic principles. After these words, I want to make sure that I take care of those of you who I am tutoring. So if you need tutoring, please write the following information down, and then I will start today's lesson. So when researching these definitions, I've decided that I'm going to read the textbook definition first, and then I'll switch it up and explain to you how it would relate to us as nurses and also to us as we take our NCLEX exam. So, the 5 basic principles of ethics, medical ethics in particular, well, just ethics in general, is this: autonomy. Individuals must be respected as independent moral agents with the right to choose how to live their lives. Now, see, something like that needs to be switched up. This is why I'm going to explain later. Because, yeah, an individual can be autonomous. They have the right to be independent and choose their medical care. But what if they take a turn for the worst? And let's say they had a stroke and they can't think straight for themselves, right? So this is why I need to read the textbook first, and then I'll explain it to us as NCLEX exam takers and us as nurses. So that's the definition of autonomy. Now, beneficence. One should strive to do good where possible. That's beneficence. Non-maleficence. Non-maleficence is one should avoid doing harm to others. Now, social justice cracked me up. It took me a step back for a minute, really, to tell you the truth. People should be treated fairly, although this does not equate to treating everyone equally. Isn't that the truth? Isn't that the truth? Don't you think someone like Brad Pitt or Angelina Jolie might get better medical care than Annalise Garrison walking into the hospital? Sure, but I'll talk about that and how it relates to the NCLEX. So we treat all of our clients fairly, but we don't necessarily treat them equally. Interesting. I'll talk more about that in a second. And veracity obliges you and I to tell the truth to an individual. So that's the textbook principles of medical ethics. Now let's talk about it, how it relates to the NCLEX and how it relates to nursing. Okay, let's tackle autonomy first. For the NCLEX, when you see the word autonomy, you want to think independent, right? An autonomous person is an independent person. Now remember what I said, that the individual must be respected as an independent moral agent with the right to choose how to live their lives, or with the right to choose, in the case of us nurses, the right to choose what medical care they will receive. But a client's legal right and a client's cognitive ability becomes blurred here in a case of, let's say, a 64-year-old diabetic newly diagnosed with Alzheimer's. Let's say he's had 3 car accidents in the past 2 months. You are the nurse working in the ER. You know this individual because they come to the ER occasionally because they've had spells with their diabetes. But now you've noticed that the person is not thinking clearly. He seems to be getting worse and worse. Every visit, this is his 3rd visit, every visit he comes, at first you thought it was his diabetes, right? Maybe his low blood sugar. But now you've noticed that, his blood sugar's fine, but he still can't think properly. He still can't communicate what he wants to you because of his Alzheimer's, right? Now, he has the right to continue to drive his car, for example. He's got a driver's license. But this is his 3rd accident. This is the 3rd time he's been to your ER in the past 2 months. So he's got a legal right to drive. But because of his Alzheimer's, is he really capable of driving? Right? Our responsibility as nurses is to keep the client safe from being a danger to himself or others. So in this particular example, we would have the responsibility to call somebody higher in charge of his health care to see if possibly his license should be pulled, even though he's got that legal right to drive. He's been in your ER 3 times because of accidents in 2 months. Plus he's got newly diagnosed Alzheimer's. So as a nurse, you have the responsibility to call his doctor and see what his doctor wants to do about his driving. It will then be his doctor's responsibility to possibly call the Division of Motor Vehicle and have his license revoked for medical reasons. Possibly. But we as nurses have a responsibility to report this situation. So with autonomy, they have the right to make independent decisions, but if they have cognitive problems, there needs to be intervention. That's what I want you to take away from this section for the NCLEX. All right, now let's tackle beneficence and justice. Earlier I said social justice, but I think the NCLEX just has justice as an answer because there was an actual question on the NCLEX. So let's talk about beneficence. This means to do good where possible. When it comes to nursing, you want to take active steps to promote and benefit the welfare of the client's support system, and when appropriate, others. That is what beneficence means. Now, when we talk about justice, remember I said I was taken back because justice was people should be treated fairly, although this does not equate to treating everyone equally. For the NCLEX, I just want you to know that when it comes to justice, this means that you treat the client and support system fairly without any malice, bias, or prejudice. And what I'm going to reiterate here is we cannot always control equality. This is an NCLEX alert. There was a question on the NCLEX, something about the nurse manager studies looks at a research study, and she notes the staff's attitude towards the client. This affirms which ethical principle? In this case, the answer would have been justice, right? Because we're supposed to treat the client and support system fairly without any malice, bias, or prejudice. So the staff's attitude
towards the client would fall under the ethical principle of justice. This is the end of the NCLEX alert. The last two ethical principles for the NCLEX we're going to talk about is non-maleficence and veracity, and they're pretty much self-explanatory. Non-maleficence means to do no harm. All right? Now, unfortunately, sometimes harm does happen in the medical field, and the NCLEX does test this. They test this by giving you a scenario, saying this is going on. What forms would you fill out to avoid malpractice? So non-maleficence means to do no harm. And I do go over what forms to fill out when I do tutor you on the NCLEX during my legal session. So don't worry, I'll cover what forms to fill out. That's not part of this lesson. So in a nutshell, non-maleficence means to do no harm. And veracity means to tell the truth to your client. Now, why is it good to tell the truth to your client? For several reasons. Because it promotes accountability and professionalism if we tell the truth to our client. It enhances our relationship with our client and their support system, right, if we tell the truth. And it also facilitates in building trust between ourselves and our client and their support group. So it gives for a very nice relationship between nurse and client if we tell the truth to our client. Now, when we tell the truth to our client, we don't want to say, we want to remember to use therapeutic communication, right? You don't want to use words that are too big that they don't understand. You don't want to talk down to them. You don't want to be condescending to them, right? You want to be totally respectful and tell the truth when it is appropriate to do so. Well, thank you for joining me for this rather deep presentation, but this will be on the NCLEX in some way, shape, or form. So please, if you need tutoring, make sure you take down this information that I'm going to show you. Have a good night, and I will see you in the next presentation.